Hello, the lecture this week is Communicable Diseases. We will review the costs and consequences of communicable diseases of importance and outline some of the most important examples of successful interventions against communicable diseases and discuss key challenges to the future prevention and control of these diseases. Communicable disease transmission can be transmitted from animal-animal, animal-human, or human-human. Communicable diseases are synonymous with infectious diseases, which include infectious and parasitic diseases. You will be learning about different terms in this lecture. Emerging infectious disease is a newly discovered disease. Eradication of a disease is the termination of all disease cases and its transmission globally. A parasite is an organism that lives in or on another organism and takes its nourishment from that organism. Re-emerging infectious diseases are existing diseases that have increased in incidence, spread to a new place, or have taken on new forms. This slide shows you the different terms you will encounter in this lecture. Please make sure you are familiar with them. This slide shows the leading causes of death globally by age group and shows you the percentage of total deaths. In 2016, lower respiratory infections had the highest percentage of total deaths, and other congenital defects had the lowest. The costs and consequences of communicable diseases are essential for the ability of individuals to get the medication and follow the physician's instructions. Constraint in the health and development of children, affecting schooling and adult productivity. Communicable diseases cause strong stigma and discrimination associated with HIV, TB, and others such as leprosy, and limit productivity and income of adult workers, and the cost to treat those diseases will burden the economy of the families. High rates of communicable diseases reduce investment in a country's development. The burden of emerging and re-emerging infectious diseases. Examples of emerging infectious diseases: SARS, China 2002. MERS, Arabian Peninsula 2012. Examples of re-emerging infectious diseases: Ebola, West Africa 2014. Cholera, Yemen 2016. Antimicrobial resistance. The resistant forms of the disease can emerge or re-emerge when bacteria, parasites, and viruses are altered through mutation, natural selection, or the exchange of genetic material among strains and species. Examples of drug resistance: HIV and a first-line drug, MRSA beta-lactams. Antimicrobial resistance. In 2017, about 558,000 people globally developed multidrug-resistant TB, and there is resistance to all malaria drugs. Factors contributing to drug resistance development include increasing drug use, poor prescribing and dispensing practices, inappropriate use, failure of patients to take correct dosages, and counterfeit drugs. The consequences of emerging and re-emerging infectious diseases. Substantial direct and indirect costs are not proportional to deaths from these events, and drug resistance costs are also very high. Treating a case of drug-resistant TB has been estimated to be about 175 times the cost of treating a case with first-line drugs. This slide shows you that the cholera epidemic had a high cost of $771 million in Peru. The other diseases that are shown in the slide give you an idea of other amounts due to the mentioned diseases. Addressing emerging and re-emerging infectious diseases. Sensitive surveillance systems and public health laboratories help us track emerging infections. It is important to have global collaboration and willingness to share information with other countries. It is important their rapid detection of new outbreaks and have mechanisms for effective containment. Addressing antimicrobial resistance. It is crucial to improve surveillance and laboratory capacity. For patients, uninterrupted access to essential medicines of assured quality. The regulation of medicines, including in animal husbandry, is needed globally, as well as improved infection control and innovation. Future challenges: antimicrobial resistance, emerging and re-emerging infections. Rapidly evolving pathogens, population growth, and climate change will increase the number of diseases and the development of a major pandemic. Accelerating drug resistance is happening worldwide, and a limited number of anti-infective drugs are being developed. Below is critical information about the burden of HIV/AIDS in 2017. Number of people living with HIV/AIDS, 36.9 million. The prevalence among adults aged 15-49, 8%. The number of new HIV infections, 18 million. The number of HIV-related deaths, 940,000. The proportion of all adults living with HIV receiving ART, 59%. The burden of HIV/AIDS. When HIV first appeared in a population, it initially concentrated in sex workers, men who have sex with men, or injection drug users. The highest prevalence rate of HIV/AIDS is sub-Saharan Africa, 47% of the adults aged 15-49. In sub-Saharan Africa, women are twice as likely as men to be living with HIV. HIV treatment. The global community has made a commitment to trying to ensure that all people with HIV are placed on treatment when diagnosed. UNAIDS estimated that in 2017, 75% of HIV-positive people knew their status and 79% of them were on antiretroviral therapy. Addressing the burden of HIV/AIDS. There is a need for a vaccine and to focus on prevention of new infections and 90-90-90. Successful efforts have included strong political leadership and open communication. Approach to prevention must vary with nature of epidemic. Efforts need to combine education and behavioral change, biomedical approaches, structural approaches, and early treatment. Addressing the burden of HIV/AIDS. Successful efforts will involve condom promotion, screening and treatment for STIs, prevention of mother-to-child transmission, voluntary male medical circumcision, and interventions that target populations that transmit the virus from high-risk to low-risk populations. 90-90-90 goals by 2020, which means that 90% of the people with HIV will know their HIV status, 90% of those with HIV will be receiving antiretroviral therapy, and 90% of those being treated will have suppressed viral loads. Critical challenges in HIV/AIDS. Developing a vaccine, the cost-effective approaches to prevention in different settings, and universal treatment for all those who are eligible, financing treatment, and management of TB and HIV co-infection. TB is increasing in the number of people infected with the TB bacillus. Unfortunately, if this person is not diagnosed, he or she will infect another close individual who lives or works with him/her. Many times, migrant individuals coming from countries where the TB is common will infect persons in a place where the TB was controlled. The burden of TB. In 2017, TB was the 13th most important cause of death worldwide for all age groups and both sexes. However, the incidence of TB has fallen by about 2% each year. There has been an increase in TB infections that are resistant to one or more TB drugs. In 2016, 560,000 new cases of active TB were infected with drug-resistant TB, of which 82% were multi-drug resistant. Resistance ranges from resistance to one first-line anti-TB drug only to multi-drug resistance MDR and extensive drug resistance XDR. Resistance to the drugs develops, largely due to failure to complete TB treatment. Due to the costs of the treatment for TB, many infected individuals will begin, but will not be able to complete it and follow up with the laboratory test needed to ensure that he is free of the bacillum. Addressing the burden of TB. Bacillus Comet-Guire and BCG vaccine has limited impact on incidence or prevalence. Control of TB depends on effective treatment of active tuberculosis and social determinants. WHO recommends a 6-month regimen for drug-susceptible disease, includes 4 drugs, highly cost-effective, $5, $50 per dolly averted. Patient adherence to TB regimen is essential. Management of TB co-infection. TB is an opportunistic infection of HIV. Scaling up the 3 is intensified case finding, giving isoniazid antibiotic to people with HIV to help prevent their getting TB. Enhancing infection control in healthcare settings so that TB does not spread. The WHO has a strategy to eliminate TB in the world. However, for this to be accomplished, many poor countries will need help from developed countries to provide medication for all infected individuals and follow with preventive measures as well. The burden of malaria 2017. The number of malaria cases is 219 million. Number of malaria-related deaths, 548,000. The burden of malaria-related deaths, 93% in Africa, 61% occurred in children under 5 years of age. The leading cause of DALYs in sub-Saharan Africa among all age groups. The necessary risk factor for malaria is being bitten by mosquitoes that carry the malaria parasite. Pregnant women who contract malaria are at heightened risk of maternal death and giving birth to low birth weight children. Addressing the burden of malaria. Critical interventions are needed to address malaria expansion to other countries. Those are prompt treatment of those infected based on the confirmed diagnosis, intermittent preventive therapy for pregnant women and infants, Use of seasonal malaria chemoprevention for children under 5 in selected areas. Long-lasting insecticide-treated bed nets for people living in malarial zones. Indoor residual spraying in malarial zones. Addressing the burden of malaria. Appropriate treatment required so that when mosquitoes bite people, they will not carry malaria to another person. WHO today recommends artemisinin-based combination therapies act for treating uncomplicated malaria caused by P. falciparum and for treating P. vivax infections that are not responsive to chloroquine. Challenges in addressing malaria. There are substantial gaps in diagnosis and treatment. The national malaria programs must find effective ways of working with private medical providers. Dispersal of counterfeit and low-quality drugs. Better diagnostics and development of new drugs. Growing resistance to the insecticides used for indoor residual spraying. A safe, effective, and affordable vaccine. Addressing the burden of diarrhea is vital to decrease complications that will cause severe dehydration. Those disease prevention strategies are: promotion of exclusive breastfeeding for the first 6 months, improved complementary feeding after 6 months, rotavirus and measles immunization, improving access to clean water supply and sanitation, coupled with hand washing with soap. Addressing the burden of diarrhea. Case management interventions include oral rehydration therapy, zinc supplementation, and selective antibiotics as appropriate. Zinc supplementation for 10 to 14 days could reduce duration of diarrhea by 25%. This slides provide you with the list of neglected tropical diseases. The consequences of the neglected tropical diseases. Other possible complications: blindness, liver cancer, remarkable swelling and skin problems. Increased susceptibility to other infectious diseases, and social stigma, and impact on productivity, school attendance, and future wage earning capacity. Addressing the neglected tropical diseases. The availability of rapid impact packages of drugs for the 7 most common NTDs is essential to treat those. Public-private partnerships are important, such as pharmaceutical companies donating drugs for rapid impact packages to those countries where they cannot afford to buy them. Primary care physicians need to discuss with the children's parents to provide medication for deworming them, and it is considered this action the best buy in global health. Opportunities to integrate NTD treatment programs with existing HIV and malaria control programs. Future challenges for neglected tropical diseases. Hookworm and schistosomiasis vaccines need to be developed. Develop new drugs to combat the NTDs more effectively and combat resistance. Work with communities to combat underlying risks such as hygiene, unsafe water supply, unsanitary disposal of human waste, and worm and parasite breeding sites. Enhance political commitment to the prevention and control of these diseases. Work with communities to overcome underlying causes. Because health systems in many low and middle income countries will continue to be weak, it will be important for efforts to be based on partnerships, often with the private sector. Among the challenges to controlling communicable diseases, the slides provide you a list of possible actions that will help. However, we need to focus as well on the education of those communities, since using preventive measures such as washing their hands and following proper hygiene will improve the results. Enhancing global cooperation on disease surveillance and action is essential for effective prevention, detection, and control of emerging and re-emerging infectious diseases. Global efforts will be needed to promote more rational use of antibiotics and better quality of antibiotics. HIV/AIDS is a significant burden, but the number of people infected with HIV and HIV-related deaths has been declining. The number of multi-drug resistant TB cases are increasing. Malaria poses an exceptional burden of disease, mainly in SSA. The main message is that the economic and social consequences of communicable diseases are considerable. The direct and indirect costs are high for families and the economies of all countries.